Hi everyone, this is Dr. Pasunuti Sumanth, consultant pediatrician, and this video is regarding the impact of vitamin D on your child's health. So, what does this vitamin D do? This helps the body appropriately absorb and regulate calcium, which is essential for bone health. And without enough vitamin D, kids may suffer from weak or brittle bones that break easily. To make it simplify, vitamin D acts almost like a construction site supervisor. It makes sure the materials we need for strong bones such as calcium and phosphate are where they need to be and in the correct amounts. Not only causing problems with bones and muscles, there is evidence that low vitamin D is linked to other health problems as well, such as high risk of bowel cancer, heart disease, high blood pressure, stroke, and problems with immunity and autoimmune diseases. And the severe deficiency leads to a bone condition called rickets, and this can lead to bowed legs and stunted growth. So, where does this vitamin D come from? First one is the sun. Our bodies make vitamin D when our skin is exposed to sun. But it's very hard to get enough vitamin D from sun, especially in children. The next one is from food. Actually, very few foods have vitamin D naturally. The foods with the most vitamin D are fatty fish and fish oils. Kids don't eat these foods a lot. That's why food companies add vitamin D to milk, yogurt, baby formula, juice, cereal and other food items. And this process is called fortification. Now we'll see the signs and symptoms of vitamin D deficiency in children. Many people with low vitamin D do not have any symptoms, but few might complain of bone and muscle pains. Very low vitamin D can lead to soft bones, causing rickets in children, and the same condition is called osteomalacia in adolescents and adults. Very low vitamin D can lead to soft bones, causing rickets in children, and the same condition is called osteomalacia in adolescents and adults. And the most common age group in which this condition is seen is around 6 months to 3 years of age. Low vitamin D can cause low calcium, which can lead to muscle cramps in children, and this can also lead to convulsions in particularly young babies. Now we'll see the children who are at risk of low vitamin D. Children with very dark skin, the melanin present in their skin acts as natural sunscreen and increases the time they need in the sun to make vitamin D naturally. In children whose skin is rarely exposed to the sun, such as children who doesn't prefer outdoor activities. In babies who are born prematurely, and also babies who have been exclusively breastfed because breast milk does not contain much vitamin D. A baby will get their initial store of vitamin D from their mother, so they are at risk of low vitamin D if their mother has low vitamin D or if they have dark skin. And also in children with conditions affecting the absorption of vitamin D, such as liver disease, kidney disease, and problems absorbing food and some medications. So, how much vitamin D does your child need? Vitamin D is measured in international units. So, babies younger than 1 year old need 400 international units of vitamin D a day. According to Indian Academy of Pediatrics, vitamin D is must for all the newborn babies from day 1 to 1 year of life, and this is followed all over the world. If at all you are not affordable, it is must till 6 months whatsoever. This recommendation is due to deficiency of vitamin D in breast milk, and the child will be exclusively breastfed till 6 months and will be the main source of nutrition at least till 1 year of age. So, if your doctor forgets to prescribe vitamin D for your baby, please remind him. And kids older than 1 year need 600 international units or more of vitamin D a single day. Most of the commercial preparations contains 400 international units in 1 ml, and few of them contain 800 international units in 1 ml. So keep in mind about the dosing for your child. Now we'll see about the sun exposure and vitamin D. For most children, low vitamin D can be prevented by spending time outside. Children with light skin get enough vitamin D through the sun during normal daily outside activities. And children with dark skin need a longer time in the sun to make enough vitamin D, up to 3 to 6 times as long as someone with light skin. When to see a doctor? Take your child to the doctor if they show any symptoms of low vitamin D, such as soft bones, muscle cramps, or bow legs or knocked knees, as told earlier in the video. Now we'll see the vitamin D deficiency treatment. Daily recommendation of 400 international units or 600 international units is different from treating deficiency. Once deficiency is confirmed by testing vitamin D levels in blood, your child will be given a long course of vitamin D for at least 6 to 10 weeks. And tell your doctor if your child is taking any vitamin D tablets in before, because as too much vitamin D can also cause problems. Children with low vitamin D also need enough calcium in their diet. Aim to give them 2 to 3 serves of dairy each day. It's nothing but 1 serve of dairy is equal to 1 glass of milk or 1 tub of yogurt or 1 slice of cheese. This is all about vitamin D in children. Hope everyone won't forget to give their child a daily dose of vitamin D. And thanks for watching. Please do like, share and subscribe.